It's a wide open evening. Ask your questions about anything: vascular disease, cancer, accident, sleep apnea, stroke, heart attack. Ask anything tonight on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. We are excited as it has been a while since we've had an Ask Anything program. But first, let's take a look at this week's Prairie Doc Quiz question. True or false? People with Alzheimer's dementia usually have a stepwise worsening and a halting gait or abnormal walking rhythm. And people with vascular dementia usually have a normal gait until late in the disease. True or false? Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of my essays, originally written for the show, comes with a wonderful accompanying photograph by Dr. Judith Peterson. We will announce the answer and the winner at the end of the show. And remember, you only have 10 minutes to get your answer in. We answer your questions about, well, anything medical, as they are called in or sent to us via Facebook or email. Call in questions to 1-888-376-6225 or send us an email to the address on the screen. Remember, ask anything. This is your show. Please give us your questions. See if you can stump these stars. Joining us tonight are Dr. Tyler Harrell, a podiatrist with Avera Orthopedics in Brookings, Dr. Steve Schroeder with Avera Medical Group in Miller. Steve is also the medical director for the South Dakota Foundation for Medical Care. And joining us via Skype tonight is Dr. Mitchel Penn with Penn Medical Center, Tortola, British Virgin Islands, a place where I am sure it is much warmer tonight than here in South Dakota. Thank you for joining us, all of you.
Thank you.
And we'll start with you, Tyler. You are a podiatrist, yes, and you care for, I think, diabetic feet, but you care for everybody's feet. And in this kind of weather, is cracked feet and sore feet, like we get on our fingernails, is that similar in the feet, and what do you recommend for it?
Absolutely. I think you notice a lot of times this time of year, whether it's end of October going into November, December, around the holidays, people are on their feet much more. We don't necessarily always wear socks in the house. We don't always moisturize or do things that we might do otherwise if we have a problem. I think one of the main things you can do is to use like a cream, something that's not alcohol based, that is going to actually keep the moisture inside. Some of the over-the-counter brands I've seen used, or like myself, is Eucerin. CeraVe is a good brand. It's more of the cream of the lotion than just an alcohol base that it won't evaporate as quickly. One thing people can do, and you got to be careful because you don't want to do it too much, but when you apply the cream, you actually can use saran wrap or put a sock on, something that actually keeps the moisture inside.
Yeah.
It's
kind wonderful advice.
It's kind of weird to think about. Thanksgiving, what do we do with meats and things? We try to keep the moisture inside. It's kind of the same with your skin and everything story along those lines.
And people talk about walking around with socks. They can slip and fall. So I've heard that the best shoe is really a tennis shoe for the safest thing for an elderly person. What is your take on that?
As long as there's a non-slip sole, something that is actually going to grip. You don't want something that's too grippy that you might trip on a carpet or along those lines, but anything that's going to have a sturdy heel counter, something that is a little more rigid in the heel and flexible in the toe area, I think is going to be more beneficial to you. But if you're going to be around the house, having a pair of slippers, something that does have a non-slip sole or traction to it, is going to be better to prevent those slips.
Okay. And I'm gonna turn to you, Steve. You are the director of the Foundation for Medical Care, or also the Quality Improvement Network, which is QUIN, as they say, right?
That is correct.
And so, with that lofty position, that all-important spot, What is the scope of work that Quinn does, and tell us more about quality parameters that the government's looking at?
Well, the South Dakota Foundation for Medical Care is now known as the Quality Innovation Network. We combine with the states of North Dakota, Nebraska, and Kansas to help deliver quality care to Medicare beneficiaries in our 4 states. We've existed in this state for a number of years, back since the 70s. We initially started as what's called a peer review organization, where we'd look at cases and deliver opinions about the quality. But more recently, we have gotten into the area of improving quality by working in a number of areas, and I must take my hats off to the staff at the foundation. There's about 20 of us that work there. The office is in Sioux Falls, but we're based around the state, and we work with hospitals and nursing homes, long-term care facilities, clinics, to improve in quality areas such as, well, we'll start out with hypertension, controlling hypertension, which helps prevent disease down the line.
Strokes and heart attacks.
Absolutely. Diabetes is another area that we've gotten into, and the emphasis in diabetes is on patient education. Not only is diabetes a disease that requires good foot care, but it also requires control and being able to manage your diet and your activity when you're out of the office. So patient education is very important.
Responsibility to the patient.
Absolutely. It's all patient-centered. Other areas of work include antibiotic stewardship, making certain that those who prescribe antibiotics do it in a proper way and in a timely way. We work with what's an area known as care transition, which is actually started out as just a way of looking at preventing readmissions to the hospital within 30 days, but it really has expanded more to make certain that when a patient goes home from the hospital, they have proper care and their medication list is up to date. It's a safety issue. We have other areas of medication safety we work with. Some of our staff are dealing with the IHS hospitals in West River.
The Indian hospitals.
Yes. We deal with pharmacies. Dr. Jane Mort from the college here in Brookings works with us part-time as a means of helping us with medication safety, making sure that what we administer to medications are timely and important and safe, most important. So we work in a lot of areas, and as I said, I'm very pleased to be able to work with a good group of individuals based both in our office in Sioux Falls as well as around the state. It's been very beneficial.
So would you say that you're an extension of the government?
We are an organization that contracts with the government, and looking back historically, as I said, we are now out of the case review, as it was called. That's done by another entity, so that if you are a Medicare beneficiary and have a complaint about the quality of care, that
wouldn't be you, it would be somebody else.
Yes, that's right. To KeyPro is the name of the organization. You'll see that if you're a Medicare beneficiary.
In South Dakota? Is that a South Dakota?
No, there are actually 32 states that are combined under KeyPro now that deal with beneficiary complaints.
And the KeyPro base is
in Ohio, actually, I think is where their base is. So things change, but for the better in most people's regards is that we're now an organization designed to help people. In the past, hospitals and fellow doctors were a little concerned that when you got a call from the foundation, it may be a good thing or a not so good thing. And so we're happy to be now in the assistance of quality care in the state, working in all these areas, and happy to be of service.
Right. Mitchel, you are a friend that, because of my wife Joni, who was exploring this whole world of the British Virgin Islands. You have been on the show before. It's such a pleasure to have you here.
Always a pleasure.
Yes, and the part of the story I really would like you to say a little bit about is what happened in the Caribbean, well, what happened in the British Virgin Islands, Tortola, where you live, 2 years ago.
Well, I think everyone in your part of the world, with the snap weather changes that you're experiencing now, we experienced something very similar in terms of windstorms. The most powerful windstorms to ever cross the Atlantic, crossed bullseye over a very small jurisdiction. And the blast wave pretty much tested every structure on the island. So we had many challenges in terms of creating access for our patients Medications were in very short supply, but we got the job done. Everyone stuck together, and we got all of our patients taken care of.
You know, you told me that you ran a generator for 6 months after that 250-mile-an-hour windstorm that hit your home.
Absolutely. Absolutely. I think that you saw the boats and everything when you came. It was 100 times better than what it was when it originally happened. But we are quite resilient, and this is a part of the world that we're committed to, and it's one of the most beautiful parts of the world that I've ever seen. So we'll continue to do our best to bring it back to its pristine beauty.
I would say this, and I'm not unbiased. I had a sailboat that was chartered, so someone else was paying for the sailboat. It's an investment deal. But that sailboat went upside down and was totaled in the storm. No question about that. I'll tell you this. I was sailing in the British Virgin Islands. I chartered a boat. I didn't buy a new sailboat. I chartered a boat and had 2 weeks of the most wonderful sailing and the most joyous time in the most beautiful part of the world this January. And so if any of you are listening, would ever consider going back to the British Virgin Islands, do it. Or charter a boat, have a captain if you're not a sailor, and do that to go between islands. Oh my goodness, it's a wonderful experience. And if you want more information about sailing in the British Virgin Islands, send a question to prairiedoc.org, and I'll get information to you and make sure that the people from the BVI are able to connect with you, because it's a wonderful place.
Absolutely.
Any other health issues about the British Virgin Islands that you would like to, what are the major illnesses that you have that we do not have?
One of the things I'd like to highlight is that we made a tremendous milestone in terms of access to care. We've now made it a universal access system where every single person on the island has health insurance. And I think that has made the big difference in terms of persons now being able to have better compliance with their chronic diseases in terms of access to medications and access to their physicians. And so it's a whole new world now. We're all quite busy.
That's great to have you explain that, and I'm looking forward to getting down there again, Mitchell. The hot, new, most modern treatments and procedures are wonderful advancements, but it's good to remember the past. We go back over 50 years to see how far we've come with a dear friend, Dr. Stan Allen.
We didn't see patients by appointment in those days. I don't think anybody in any of the other doctors in town were seeing patients by appointment. A patient would walk into the clinic, register, say who they would like to see, and then sit down and wait. In those days, it was a requirement that if you were doing major surgery, like abdominal surgery, something like that, any major surgery, you had to have a second physician scrubbed in with you. So that was a slot that I had to fill at that point. We left Dr. Kilgard and Dr. Clark handling the clinic, and at least half of most days I was tied up being an assistant to the surgeon in surgery. In those early days, we didn't have any plastics like they have today. All the syringes we used were glass syringes. They had to be cleaned and re-sterilized and used over and over again. The same was true of the needles that went with these syringes. They had to be cleaned, re-sharpened, and re-sterilized and used over. All of the surgical gowns, masks, all of that stuff were all cloth. They had to be washed and re-sterilized. So that in itself was a big job to keep all that going. You reused rubber gloves, so you had to check them. If they didn't have a leak in them, you cleaned them up and re-sterilized them and used them again. There were some students that I mentored over the years that I didn't really get that much out of, you know. But Rick was an exception, and I had the impression when I had him that he was a young man that was going to do well in his profession, and I think that's been brought out in subsequent history.
This is your program, and your questions are key to the direction of our discussion. Please call in your questions to 1-888-376-6225, or send us an email to ask@prairiedoc.org, and we've got some questions. Thank you for calling in. Brookings man is wondering, what are the long-term effects of stimulants, especially Adderall, in the human brain and body? Mitchel, I'm going to ask you that. Do you have an opinion about Adderall and stimulants on the chronic use?
The chronic use of stimulants, we know that it's not the very best thing for persons to remain on stimulants for a very long period. Tolerance is one of the issues. You need higher and higher dosages just to let the same stimulant have the same efficacy, and there you end up with some toxic effects of the medication. So one has to be sure of the diagnosis when using the stimulants.
Yeah, and I'll throw that back at you too, Steve. I know that, I don't know if you prescribe Adderall for little kids and have done a lot of that, but I really have never, because I'm an adult doc, but I've often felt reluctant about that. I know there are people that are really benefited by it. The question is who?
Well, in the past, I did prescribe that for children with attention deficit disorder, assuming that there was, you know, information that correlated and made certain that was a diagnosis. In terms of use in adults, as the question may go, I rarely have ever seen it used, maybe once or twice, and certainly would want to consult a number of other individuals as to whether this was an appropriate medication. You know, bottom line, I'd be very concerned about it.
Right, I reflect both doctor's reflections there. A Sioux Falls woman says, I've had diabetes for 10 years. During this time, sugars have been up and down at times. What's the progression of the disease? How confident are doctors that diabetes can be controlled? I'm going to start with you, Tyler, about diabetes and control. You deal with a lot of diabetics since you are a podiatrist and feeder this story.
Yep. One of the things I've noticed, and I get a lot of I don't understand why, you know, I see some of the progression of, say, like a neuropathy that starts in the toes, or, you know, why is it always those furthest parts? One of the things with an increased blood sugar, increase in those levels, you'll see some of the demyelination, you'll see changes of the nerves that happen at the furthest point away from their origin, which would be like the spinal cord. People will come in and, you know, they may start having neuropathy. It could be the early signs of a person that has diabetes who hasn't had their blood sugars checked.
The diagnosis
hasn't been made. So,
or so even a pre-diabetes.
Yes, absolutely.
So it's important, I guess, you start seeing those changes. You know, don't ever hesitate to ask your doctor, podiatrist, orthopedist, whoever it may be, if there's concern for that. Make sure you just bring it up, and it's something that if it needs further evaluation, if we do our tests, we do evaluations, we can always get that, you know, working down the road and come to an answer, and maybe we can prevent further trouble down the road.
Right. There's a question about the diagnosis of neuropathy, diabetic neuropathy, all kinds of peripheral neuropathy. And being a person who is struggling with peripheral neuropathy associated with chemotherapy for my cancer, I have looked at all of the drugs that we have available, and they're all sort of a cover-up drug. They all make you less alert so that you don't feel bad about it. None of them do anything really about the neuropathy. I will say this, that people who get neuropathy, there are many causes, some of which we have, a lot of which we have no control over. But vitamin B12, B1, B6, B vitamin deficiency can cause it too. So since you can't know, I'm taking vitamin B12 and vitamin B1 and 6 combination, and I'm living with it. I'm happy to be alive because the chemo has kept me alive, and I'll put it that way. Any other comment about diabetes? Mitchell, you want to say one word about diabetes control?
What we've noticed in our populations, diet is very important. The high caloric foods, the white flour based foods, when we shift our patients away from those products to the whole grain products, the diabetes just settles right down. Very interesting.
Yeah, I totally agree. I think everybody's saying corn sugared drinks, white flour, the carbohydrates. Cut down on the carbohydrates. Eat the complex fiber foods and so on and so forth.
Consulting with a dietitian is oftentimes very helpful when you learn about what you should and shouldn't dine with.
It's an amazing thing. Take a diet diary for a week and then bring it into the dietitian and say, here's what I normally eat, and see what happens. An Aberdeen man asks, is pancreatic cancer and liver cancer on the rise, and is there a reason for it?
You may be as big an expert on that as we have.
I would say that we are certainly making the diagnosis more often.
Yes.
I have a compatriot, a good friend and peer, who thinks that it's happening because of environmental factors. But I think that if you look at all of the scientific studies, maybe our diagnosis is occurring more now because we have the tools. It was happening before when they would die of cancer of unknown origin. I don't know any source except to say that it's a good idea to eat a good balanced diet, exercise regularly, and life has its curveballs. Any other comments from any of you?
No.
Okay, I've got a Belfouche woman asks, I use a CPAP machine, but not if I fall asleep on the couch. I had pneumonia in May, started getting better, but now if I sit down for any length of time, even 10 or 15 minutes from 5 to 8 p.m., and my head just drops and my neck is sore, it can be an hour to 3.5 hours that I fall asleep. Now that it's starting to throw off my sleep time, I'm on several medications. I have rheumatoid arthritis, fibromyalgia come on. All of a sudden, my body doesn't usually do this from medications. This narcoleptic stuff is starting to scare me. What do you think? Steve?
Well, it'd be nice to know what the other medications are on. I think that's one of the first areas that you would look to is potential side effects from medication, and is it interfering, making sure your CPAP machine is properly
adjusted. Please don't skip the CPAP. The CPAP is so important.
Absolutely.
And look at your medications. I think increase your exercise. If you look at fibromyalgia, the most important thing you can do is exercise.
Absolutely.
I think that's a tough one. We just need to know more. A Wakanda man asks, I have had an abscess infection in my front bottom tooth for a couple years that won't go away. I've taken prescribed antibiotics, but it doesn't seem to help. Can an infection like this spread and cause throat cancer? So an abscess infection in the front bottom tooth. Mitchell, what do you recommend?
Generally, your dental teams will drain that, and if you have good proper drainage, that just should be sorted.
Yeah, I agree with you.
It should not be chronic.
Right, it should not be chronic. It needs better treatment than what she's had or he's had. And abscess infection should be not reoccurring. We need to, it needs a more aggressive treatment. And maybe your regular doctor, your dentist, whoever's handling this, would do a better job, needs a third shot at it. Usually it's not antibiotics that solves the problem. It's a knife. You need a knife. Open it up. Okay, one viewer says, my husband had shortness of breath and chest pains. Saw a cardiologist, no blockages, but leaky valves. Should we be concerned? Cardiologist doesn't want to see him for 6 months.
do we know which valve it may have been is nice and important, but the trust of the cardiologist, you know, leaky valve is kind of a vague syndrome that maybe perhaps a lot of us have, you know, when murmurs on our chest when we listen. I would, you know, assuming that the cardiologist has done appropriate diagnostic studies, I would not be too concerned about that.
Right.
I would sit tight
I would
and
be reassured.
patient. Yes.
I would be reassured. I don't think the shortness of breath and the chest pain is a cardiac problem. Now, there's other things that can occur. So I would get thee to a primary care doc and get further work. If the shortness of breath is going on, chest pain is continuing, continue. The Huron woman asks, I'm 85, very healthy. I was suddenly dizzy for a whole day, threw up all day long. My doctor ruled out stroke because the CAT scan was fine. Last week, a doctor said there are strokes that rarely show up on CAT scan. My question is, if that is what happened, is there anything that I should be taking? Will it happen again? I don't know what this 85-year-old woman, her blood pressure is, but I would make sure the blood pressure is controlled, not too high, certainly not too low when you stand up, because that could be part of the dizziness. I think I worry about the blood pressure being too low, actually, with this dizziness. Mitchell, you have any bright ideas?
One of the interesting things in the history, did she put anything in her ears? Is this the issue that is vestibular in origin?
Yes.
That's a good point.
Yeah. Now,
So we would need to clear that.
the majority of time, though, a lot of people are dizzy for a day, and it's just a viral infection of the inner ear, or there is a vestibular phlebolymph that kind of floats around that could be. So see your primary care person and follow up with that. A Webster woman has a sister and 2 nephews with MS. Wow, 2 nephews and a sister. 5 months ago, she developed a twitch muscle spasm between elbow and shoulder. Is this associated or the beginning of MS or something else? What do you think, Tyler?
Well,
Have you seen MS with foot results?
yeah, it does manifest itself in the foot. One thing, I guess, it's got to be a decision that she has to make. Is it possible, or is it worth her time, or is it something she wants to do to get possible genetic testing done?
Yeah.
I think, you know, if she has the concern, if there is the problem that is manifesting itself, whether it's in the arm or the foot or the leg or whatever, I do think if she has the worry, she needs to see her primary, maybe have a genetic testing done, and then we can treat it accordingly.
The only thought I have with that is that MS is usually not a genetic deal. I mean, it's a different deal. Now, her sister and nephews may have something else. That's what I think, and maybe.
True.
But her symptoms of some twitches and spasms between elbow and shoulder, that could be just worry. And I'm not to toss off her symptoms, but I would be worried too, and so any little nuance of something.
Family connection.
So get to a doctor, you know, and talk with them, and one visit is not going to be an answer. This is going to be a follow-up, a careful monitoring. Mitchell, anything that you would say more? This is a very complex question.
The history is very, very scanty, but I think that we need more time. This patient needs to be followed.
Okay. A Tyndall woman says the last 3 years her lab work comes back with low sodium. Drinks 3 to 4 beers every night. Could that be the cause? What can I do to bring my sodium up? So I don't think it's the 3 to 4 beers. No. A lot of people drink 3 to 4 beers a night. Sodium low is there's probably not one more complex issue in medicine, except for diabetes control, than low sodium. So you need to be seen for that. And obviously you are, or you wouldn't know you have a low sodium.
Yes. Is anything, you know, again, medications that she's on, diuretic therapy, could be possibly be a reason for it. There's lots of possibilities. And
psych meds in particular are powerful. Diuretics can cause them, but there are endocrine diseases that can do that. Anything that you would suggest, Mitchell?
Well, absolutely. What my colleagues are mentioning is spot on.
All right.
She needs a proper workup.
Yes. No matter how good our treatments are for disease, often when possible, the best treatment is not to get in the first place. This protection includes simple lifestyle adjustments that cost $0. Lifestyle adjustments.
First and foremost, we want to focus on people leading healthy lifestyles. So that comes down to proper diet and exercise. The second thing that we really focus heavily on is vaccination to avoid all of those pesky diseases. I would say the number one thing that we can do as far as prevention, and this goes for a lot of different conditions, from chronic disease to infectious disease, is focusing on proper eating habits, as well as getting the recommended amount of physical activity. Other things can include hand washing. That's been known to decrease the risk of respiratory diseases, decrease the risk of enteric diseases, and is a very easy and common thing that individuals can do. And then, one of the other pieces is focusing on a vaccination. I think that, we have, as a cornerstone, the ability to vaccinate people against diseases that we've eradicated in the past. And so, we see very few, cases of measles in the United States as one example. Now that is increasing in recent years because of the measles virus making its way into susceptible populations within South Dakota and other locations. But vaccination is one of the cornerstones of public health. I think the biggest disservice that we can do to ourselves is carrying on as usual when we feel sick or when our kids are sick. The downside is that a lot of times, if you're working in an hourly wage job and you need to get your kids to school, you're pushing yourself into that work environment when you're sick. You're pushing your kids into school when they may be sick as well. And so we do need to have a stronger focus on individuals staying home, and the corollary to that is having a social system that allows them to stay at home when they're sick.
Boy, we sent our kids back to school. We didn't let them stay home when they were sick, and it was the wrong thing to do. It was the wrong thing to do. Okay, we've got great questions. Thank you so much for this. And so we're going to run through the questions, and we're looking for foot questions. Sioux Falls woman says, I'm an otherwise healthy 88-year-old woman who has had blood clots to the lung that have caused me to become unconscious. What can I do to prevent this in the future? Blood clots to the lung.
Was there just one episode? Is that what the...
It caused me to be unconscious. I don't know, probably one episode.
Okay.
She must be on a blood thinner.
Yes, I'm guessing that if not, she probably should be if it was that serious an episode to help try and prevent it in the future.
I'm really reluctant about 88-year-olds, though, because they can
risk.
fall, break hips, bleed into their brains. You've got to be careful.
A filter, I don't know.
Filters, I'm not
That's
you're right.
vascular.
People talked about put a filter in, but they only last a little longer, a little while. A Gregory woman asked, what is the difference between dementia and Alzheimer's? Mitchell?
It's Alzheimer's is a diagnosis basically on postmortem. It's a spectrum of dementia, and so dementia is a big word. The question is whether it is Alzheimer's based or vascular based or some other cause.
That's right. You don't know it's Alzheimer's. We know it's dementia when it's done. We presume it's Alzheimer's when
It could be other things.
But it could be other things, and I think exactly what Mitchell said.
Absolutely.
An Alcester man says, I'm recovering from upper respiratory and viral infection. Noticed sore bumps in the roof of my mouth with the infection. Is that associated with the viral infection, Steve?
It can be, yes, associated
Yes.
with it, absolutely.
One view, and that's the answer. I mean, and the truth is viruses are severe.
Absolutely.
Get that vaccine done. It's not too late. And what's more, we're worried that it's spreading now. And the other thing to say about that is that wash your hands, cover your cough, throw that tissue away, cover your cough, wash your hands. One viewer states 2 times And let me ask you this, Mitchell, real quick. When people get cold and viruses and influenza up here in the winter, do you get it down there at the same time?
Every year, whenever the cruise ships come down, we have a world of time. Absolutely.
And we can blame the cruise ships. There it is.
Take it to them.
Yep. One viewer states, 2 times within the past week I've had difficulty swallowing food. The first time I was eating turkey, the second time I was eating dressing. I could breathe and walk around like normal, so I did not feel like choking, but it was stuck in my throat for a couple minutes, which is uncomfortable. Is this a symptom of something more serious that could be happening, or is this just a functional issue with swallowing dry foods? What can be done? And the answer is, it could be something dangerous.
Absolutely.
You agree with that?
Yeah,
I would
agree.
definitely look at passing a scope down there, because it could be cancer. It more likely is just a tightening of the esophagus.
Yes, but it's worth following up on.
Absolutely.
Tyndallman asks, I have a whooshing sound in my ears. It comes and goes, whether I am at rest or working hard. My doctor says my blood pressure is good. What might cause this? Mitchell, a whooshing in the head.
Yes, the whooshing in the head. Some patients get this very strange sensation. It's where they sense the actual flow through these vessels in the head. But it's benign.
And the vast majority are nothing dangerous. Every once in a while there could be a carotid blockage or there could be an AV malformation, but I've heard 2 of them in my life.
Yeah, no, it's very common.
Whooshing is very common, and if you're asymptomatic.
Yes.
A man from Scotland says my COPD and oxygen levels between 92 and 97, so tired all the time and gets dizzy with headaches. Is this medication related or to COPD? O2's from 92 to 97. Steve, do you think that's bad?
No, that didn't.
It's pretty normal.
Yeah, I wouldn't be too concerned about those numbers if they're accurate.
So dizzy with headaches. Maybe some of the medicine you're taking for the COPD is part of that. That's adrenaline-like medicines can sometimes do it. I don't have a good answer. Make sure your doctor knows this is happening.
Yes.
Anything else?
No.
A Yankton woman says, with this weather causing dry, cruddy nose and eye crud, what can you do other than moisturizing? And I'm not going to ask Mitchell. I'm going to ask you.
The major complaint is dryness.
Cruddy eyes, cruddy nose. I think, it's really, it's just the cracking of everything because everything is so dry.
Hydration, it would be my first advice, to make certain you get enough liquid in, and humidifying the air. If the air is dry, though, that's the simplistic approach to it.
Yeah, and I like taking what Tyler said about doing with the feet.
Yeah.
Use a cream.
That or even Vaseline. You can even mix a lotion with a Vaseline, kind of a combination, do a 50-50. And
Absolutely.
the point is to keep moisture in rather than letting it evaporate off the skin.
Hold it in. So rub down before you go to bed with Vaseline in those areas. A Millbank man says bottom of the feet by the arch gets stiff and pulls on the toes. Is there anything to do to get rid of the stiffness or make it easier to walk? A Millbank man, bottom of the feet of the arch. Mitchell?
I think there's a podiatrist sitting next to us.
Oh, what am I talking about? Wait, I'm Tyler. What am I saying?
The stiffness, I mean, there are a number of things. The foot's very complicated when there's multiple layers in the bottom of the foot: muscles, nerves, veins, arteries. Stretching is important. Being able to essentially do just simple stretches. Talk to a physical therapist if you have one or you've seen one. Talk to your doc. See a podiatrist.
Stretches.
Stretches will likely help.
What do you think? Would you just pull the foot back before you go to bed at night?
You can sit if you're able to bend over, get your foot up to like your knee, bend the toes up, even massaging the bottom. Take a golf ball, tennis ball, something along those lines. Even an ice bottle. Take a pop bottle, fill it full of water, 2/3 full, freeze it, roll it on the bottom, help to decrease some swelling. Massage, stretch, icing. Those things are really simple that almost anyone can do.
I've been looking for foot questions and
Don't stick your foot outside right now.
Good advice.
Keep it inside.
Right. Don't put it in your mouth either.
Well,
That's what I've learned in
hands,
my
foot, mouth,
life.
yeah.
My wife keeps telling me something about that. A T-man asks, our daughter has blepharospasm and a twitching of the eyelid that she can't control when she is driving. Do you know if physical therapy could help this? Who would you direct us to? She has had Botox and acupuncture, but nothing has helped so far. Now, the only thought I have is I would look at what her medications are. I mean,
Again.
and how much coffee she's drinking. Anybody else have a thought? Mitchell?
I think that you're spot on.
Okay, we're running out of time. Sue, and I don't know, a neurologist, you've already been there. I don't have a great answer. I would,
Ophthalmologist if it's the eye.
huh?
Ophthalmologist
Maybe an ophthalmologist.
if
yeah.
there's something.
Sioux Falls woman says the last 2 weeks her body has been cold from head to toe. Well, I know why that is. So am I. Unable to get warm even with electric blankets. What's the issue? Steve?
Well, lots of possibilities. Again, what medication she's on, thyroid conditions can certainly cause this. They don't usually appear in a very short time, but it's something that may be worth evaluating.
Okay. A Sioux Falls woman asked about getting her toenails cut. Is there any place in Sioux Falls to get your toenails cut?
I can't really speak for Sioux Falls.
But you can always come up to Brookings.
You can always come up to Brookings.
We have wonderful antique stores, do two things at one time.
My biggest advice would be careful if you're going to a salon or someplace. I'm not trying to say that they're bad, but make sure their stuff is actually being sterilized, the nippers, the cuticles, things that they're actually using. Make sure it's sterilized and it's been cleaned properly. If it's not cleaned properly, that's one way that things can be passed from person to person.
Okay.
My other biggest advice, if it's a female or a male, if you're putting toenail polish or something on, take your own. Don't use the stuff that's at the places you go to. You have no idea how many people that's been used on.
I always use my own toenail
Well-
polish. That's a joke. That was a joke.
It looks good down in the
Down in the BVI.
the BVI.
You know what? The woman who's cold all the time really should have her thyroid checked. And I would have her B12 checked as well. A man from Sioux Falls says, I was recently diagnosed with diverticulitis and was wondering what exactly that is and if there is anything you can do to relieve the symptoms. Sometimes it's very painful in the abdomen, and I was wondering if you could give me some ways to relieve this pain. Steve?
Well, diverticulitis is about inflammation of little outpouchings, as we call them, off the colon that happen in individuals and also in the small bowel can occur. And when they become inflamed, that becomes diverticulitis. And historically, again, things have changed, but historically we would use antibiotic therapy to combat it. How much good it does was always a question, but we certainly didn't want it to worsen. The possibility that the diverticulitis could become a worsened infections or develop an abscess is there. So, making certain that was the diagnosis, how was that arrived at would be the other question I would ask, to make certain that was what the consideration was.
Okay, thank you. I was trying to find a question up above and I lost it. And restless leg syndrome is what you deal with people with restless leg?
Yeah, it's not something that I generally prescribe meds for. It's more their primary care physician that's going to be doing that because it may have some other manifestations or problems with it. But making sure that vascularity, making sure that everything.
There's good blood flow there.
Good blood flow, circulation, nerves, make sure there's no neurological manifestations, see if there's anything else. And we kind of.
There's some easy tests to check vascularity, so talk to your primary care doctor about that or your podiatrist. Another man from Sioux Falls says, I'm diabetic and I've been most of my life. Recently I've been burning feet and toes. Why is this and what can be done about it? It's called the peripheral neuropathy of diabetes. And,
I will chime in on that. There
Yeah.
are other things that even if you are diabetic, there's a thing called tarsal tunnel syndrome.
Might be something else besides diabetes.
It's possible. It could be coming from the low back, a radiculopathy. There's more to the workup, knowing blood sugars, knowing is it controlled, is it uncontrolled. But see somebody if there is a concern. It's more so making sure that you can feel the bottom of your feet so you don't step on something and end up with a worse ulceration or wound. But I don't want to just label it as neuropathy all the time.
Right. Madison woman asked about diabetes. What's the effect of stress on sugars? Mitchell? Stress.
Cortisol is known as the stress hormone. We know it increases glucose, so we know that's a possibility. But generally, if you're stressed or not stressed, you should be able to still have good control of your sugars.
Right, and I would say exactly what he's saying, and that is, stress is one thing in life, but we all get it. Some people maybe let it overwhelm them, and does it correlate with sugars? Not usually. I mean, that's kind of one of those.
It's a concern, but not a huge concern.
Hard to answer.
Exactly.
I would say that people don't realize the value of exercise in addressing stress. And so if you can walk outside because the weather's too cold, get to an exercise place or get into a mall or a church and exercise 30 minutes every day, and that might help more. One viewer said, every once in a while I cough up blood. I was wondering if certain foods can cause this or what else would cause this and what should I do? Steve, what should he do with coughing up of blood?
Absolutely be evaluated by a physician. There is lots of potential reasons for it, but of course malignancy being a concern or blood vessels near the surface, that needs evaluation.
You need to either, with a CAT scan and maybe even bronchoscopy.
Yes, absolutely.
A man from Parker said, I diagnosed myself with rhinitis after months of sneezing, sniffling, and feeling like I was either getting or recovering from a cold. This is like months of it. I'm using store brand fluticasone propionate with some relief. Would a prescription remedy better? And the answer is, how much time do we have? We have no time, so we'll get to this question and other questions in Facebook. If you can go to that after the time, we'll talk to you more about that. And now for the winner of tonight's Prairie Doc Quiz question. True or false? People with Alzheimer's dementia usually have a stepwise worsening and a halting, irregular walking rhythm. And people with vascular dementia usually have a normal gait until late in the disease. Is that true or false? It's false. The opposite is true. Alzheimer's patients have a normal gait until late, and vascular dementia gets worse in a stepwise manner and then a halting gait. It was Marie Peterson who answered the question correctly. Thank you, Marie, for participating, and a book will be in the mail to you soon. We'll be right back after this.
Extra, extra, read the Prairie Doc Perspectives weekly essay in your local newspaper. Over 55 newspapers across the state of South Dakota include essays written by Dr. Rick Holm covering a variety of medical and health-related topics. Ask your local paper if they print Prairie Doc Perspectives.
People are drawn to sail in the British Virgin Islands for different reasons. Some go there to prove to themselves or to someone else that they have the moxie, the sailing knowledge, and finesse to sail on the ocean. Others go to find excitement, beauty, peace, or just to escape the cold of a northern winter. When I started traveling down from South Dakota in the late 80s, I did so for a number of those purposes. This year, I went for different reasons. More than 2 years ago, I was diagnosed with pancreatic cancer, and 6 months ago, the cancer had spread to one spot in the liver. After another 4 months of chemo, the cancer surgeon cut out that spot with the outside chance he might get it all. My 40 years of practicing internal medicine told me I had better do my favorite things while I can. This time I went sailing for the love of family and friends and for the sense of eternity that the sea provides. I also went to heal. I hoped that the warmth, salty sea, nurturing nature of wind, fun of the islands, and spiritual connectedness would provide a mending milieu for me. I was feeling pretty frail in the weeks leading up to the trip, but realized anew an oft-quoted wisdom. Motion of the ocean is lotion for curing what ails you. During the 2 weeks' time on the sailboat, I was always moving, clamoring to tighten some line, drop a sail, lower the dinghy, or maneuver the boat to anchor. I was moving even as I sat there. For 2 weeks, every vertebrae, joint, ligament, and muscle danced with the shifting, rocking, repositioning boat. I didn't realize the extent of the motion until I sat still for an hour in the airport on the way home. After this short period of immobility, when rising to buy a final island roadie, I noticed that I was old man stiff again. The rigidity had magically been gone for 2 weeks. Boat living was a healing potion, a lotion of motion, which provided a potent remedy and recuperation for this guy in need of generous portions of both. I believe embracing motion and change is important as we grow older, keeping us from prematurely aging, from congealing. Author Gail Goodwin says a willingness to change helps us from turning into our final frozen selves too early. Motion is the lotion. Well, a great big thank you to our guests, Steve and Tyler, for volunteering to come to our studio in Yeager Hall on the campus of South Dakota State University, and to Mitchel for joining us via Skype. This was a wonderful pool of experience to help answer your questions tonight. Thank you very much, you guys. There were many great questions we weren't able to get to during our broadcast time. We will continue to answer those questions on our Facebook page following the program tonight and on our website in the next few days. Go to Prairie Doc Facebook page. We'll be there shortly, right after this. A major portion of the country has been under frigid temperatures for the last several days. We are predicted to receive more of these sub-zero conditions over the next few weeks. It's important to take care of yourself to avoid frostbite and hypothermia. Your ability to resist disease is also decreased when you are physically stressed. So get your flu shot if you haven't done so. Well, that does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, stay healthy out there, people.
It often comes from those we trust, even love, but that is no excuse. Violence and abuse. Next time, On Call with the Prairie Doc.
All of us want our family, neighbors, and friends to have the ability to make appropriate decisions about their health care. To do so, they need access to information from reliable sources like Dr. Holm and his guest physicians. Hello, I'm Stephanie Herseth-Sandlin, and I serve on the volunteer board of directors of the Healing Words Foundation, a 501c3 organization established to support the work of the Prairie Docs. With your charitable donation, you can help the foundation continue to offer free and easy access to the entire library of Prairie Doc health education programs. This mission is so very important to rural communities and residents in particular, across South Dakota and neighboring states. Please consider a personal or corporate gift. Just go to prairiedoc.org to find more information on how you can help. Thank you.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota, and with the ongoing support of these individuals and institutions. Brookings Health System, Ophthalmology Limited, American Academy of Family Physician Foundation, and South Dakota Academy of Family Physicians. Avera Heart Hospital, Dakota Allergy and Asthma, CoBank, Fishback Financial Corporation, Vance Thompson Vision, Urology Specialists, Brown Clinic, Black Hills Medical Society, Aberdeen District Medical Society, 3rd District Medical Society, 7th District Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, Aberdeen Asthma and Allergy, and Swiftel Communications.